Dear aspirants, welcome back. I'm Dr. Samya, COO and co-founder of Study MEDIC, and this is day 5 of your MRCOG Part 2 Daily Exam Tip Series. Today's topic, gestational diabetes, is built entirely around knowing the right numbers at the right moment. Diagnosis relies on the OGTT, the thresholds from NICE NG3R, fasting glucose at or above 5.6 mm/L or 2-hour glucose at or above 7.8 mm/L. Either value alone is diagnostic. Glucose targets during management: fasting below 5.3, 1 hour postprandial below 7.8, and 2-hour postprandial below 6.4 mmol/L. The management ladder follows a clear step-up approach: lifestyle modification first, then metformin, then insulin. Glibenclamide is reserved only if metformin is not tolerated and the patient declines insulin. Timing of delivery: uncomplicated GDM no later than 40 plus 6 weeks. Pre-existing type 1 or type 2 diabetes delivered between 37 and 38 plus 6 weeks. One critical distinction the exam tests repeatedly: pre-existing diabetes is not GDM, watch the stem carefully. Preconception folic acid 5 mg and HbA1c below 48 mmol per mole are the recurring NG3 trigger phrases for pre-existing diabetes.